Welcome to the IAPAM's Clean Start HCG weight loss program. This short weight loss program is only 23 to 43 days long, and results are remarkable. A half to a pound a day average weight loss. To date, over 60,000 people have participated in this program, so you are joining an established, safe, and very effective weight loss program. With this program, you don't eat prepackaged food, you eat regular healthy food that you can find in any grocery store. In addition, you will receive a comprehensive patient support system, which includes a program guidebook, cookbook with over 50 recipes, food journal, and tip sheets. Using HCG for weight loss is not a fad. It has been used for weight loss since 1954. Dr. Simmons discovered a link between HCG and pregnant women in India delivering full-time, full-size babies, despite having a very low caloric intake. Since that time, hundreds of thousands of people have lost weight on this original protocol. HCG is short for human chorionic gonadotropin, which is a naturally occurring hormone found in the body of women when they are pregnant. It is FDA approved for the treatment of infertility in women, but not approved for weight loss. This is because taking HCG on its own will not result in weight loss. The key to using HCG for weight loss is to take prescription HCG and to follow a strict diet. If you don't do both, you will not have successful weight loss. I am going to quickly mention prescription versus homeopathic HCG. Any physician following the IAPAM's Clean Start HCG weight loss program will be prescribing full prescription strength HCG. You may find something called homeopathic HCG or HCG drops on the internet. Lab tests on homeopathic HCG have found no traces of actual HCG in the samples they purchase on the internet. As well, a study has shown those who took homeopathic HCG had the majority of their weight loss as muscle, which is exactly what you do not want to lose. In addition, the FDA has announced that HCG diet products are illegal and has gone after those who sell HCG over the internet, whereas those taking prescription HCG lost primarily fat. The HCG Clean Start program uses only 100% real HCG, which is only available through a prescription from a physician or other healthcare provider. HCG is not a catch-all diet, and it's not for everyone. This is a physician-supervised program, and it's not safe to go on this program without the approval of a Clean Start HCG weight loss trained physician. You must complete a medical history and labs to ensure the program will be safe and effective for you. As well, you must be prepared to commit to the full length of a 23 to 43 day program, and you cannot cheat while you're on the program. A very important benefit of using HCG for weight loss is that it takes the fat from the bad areas, the hips, the thighs, the belly, and the neck, all areas where fat likes to stay. In addition, there is a rapid weight loss of between a half a pound to a pound a day. Since men have more muscle than women, they usually have greater weight loss due to their requirement for more calories. HCG releases 1,500 to 4,000 of your fat calories into your body, so it thinks everything is normal. One of the big benefits of taking prescription HCG is that it improves your metabolism. I know in my case, I measured my metabolic rate before and 6 months after doing the HCG program, and my metabolism actually increased. Where typically when you lose weight, as with most diets, you don't need as many calories to sustain your new body weight, so your metabolism typically decreases as you lose weight. You will also find your appetite will decrease, allowing you to eat less and feel full. Before you start the program, we want to make sure it's a safe program for you. That is why you will complete a detailed medical history form and get some basic lab tests completed. There are very few contraindications for the use of HCG, but we want to make sure you safely lose the weight. You will be on the first phase for between 23 to 40 days, followed by 3 weeks of eating no sugars or starches, followed by slowly adding sugars and starches. So it's important that you check your calendar and make sure there are no serious conflicts, like a cruise. Secondly, you are going to need to plan your diet. The patient program guide you receive from the clinic has a detailed listing of all the permitted food, an initial shopping list, and over 50 recipes. Also, it's important not to have any massages while you're on the program. It can move the fat around and reduce your weight loss. You should take all medications prescribed by a healthcare provider, but stop taking any over-the-counter supplements and vitamins that contain sweeteners, starches, or any ingredient that is not allowed under the diet. It is best not to take any of these while on the diet phase. If you take any medications or supplements, you can expect your weight loss to be cut in half. Once you end the HCG strict diet phase, you can resume taking your supplements. The HCG Clean Start program length will be between 26 and 43 days for the first phase, which will be a combination of taking prescription HCG and following a strict diet. The first phase is followed by 3 weeks of eating whatever you like, but no sugars or starches, then followed by 3 weeks of slowly adding sugars and starches into your diet. The length of time you are on the program will in part be determined by how much weight you need to lose. If you need to lose more weight, you'll need to wait at least 6 weeks before starting an additional round. This is to prevent HCG immunity. The following slides show the effectiveness of the Clean Start HCG weight loss program. As you can see, it works. Over the course of the program, most patients see an average weight loss of between 1/2 pound to 3/4 pound a day, even as much as 1 pound a day. The variance is due to many factors. Men lose more than women. Those with more weight to lose will lose more. Your body and hormone levels, and your individual metabolic rate. Women will also have slight weight gains during their menstruation cycle. This is not a complicated program. There are actually only 4 steps to follow. When you start the HCG injections, you do a calorie load for 2 days. On day 3, you start the 500 calorie a day diet. After you have completed the HCG diet phase, you can eat anything you want for 3 weeks, except no sugars or starches. For the next 3 weeks, you can slowly add sugars and starches. And that's it, you're done. The first 2 days are load days, where you need to fill your short-term fat stores until the HCG starts working. So it's important you eat high-fat foods, not high sugar. If you don't load properly, you will be hungry and very uncomfortable the first week of the program. We have sample load day menus in the guidebook. Day 3 is the first day of the 500 calorie diet. One of the shocking parts of the program is the diet. Yes, it's only 500 calories a day, but I promise you, once the HCG has taken effect in your body, you will not be hungry. Tens of thousands of patients have followed this protocol, and after the initial start of the program, they are not hungry. I know I wasn't and often had a hard time eating 500 calories worth of food. Please keep in mind your body is not going to be operating on 500 calories a day. The HCG will be releasing the fat that is being stored in your body for energy. So if your body needs 2,000 calories a day to function, it will take 500 calories from the food you've eaten and the other 1,500 from your fat stores, so your body is never hungry. The clinic will provide you with weekly or bi-weekly lipotropic injections to help the liver process the excess fat you have in your bloodstream. Exercise is part of a healthy lifestyle. For the program, it's a great idea if you can get into the habit of doing 20 minutes of light exercise every day, preferably after a meal. Just start by walking around the block or taking your dog for a walk. You should not do any cardio or resistance training while on the diet phase. If you feel faint, stop the exercise, drink lots of water, and see your healthcare professional. Once you begin the maintenance phase, you can resume your normal exercise routine. It is also recommended that you use only oil-free moisturizers and mineral makeup, which sits on the skin. Basically, the diet consists of eating 2 servings of protein, vegetable, bread, and fruit. You don't need to eat them all at once. Some people have the fruit serving for breakfast and afternoon snack instead of with their meal. The meat must be lean. White meat like chicken breasts, white fish, crab, and shrimp. The portion size is critically important. It needs to be 100 grams or about 3.5 ounces when raw. Please note, not all fish is allowed. For example, salmon and tuna are not allowed because of their high fat content. The complete listing of meats, fruits, and vegetables can be found in the program book. What is a very important part of this phase is that you must drink at least 8 8-ounce glasses of water every day. Lack of not drinking enough water will result in a weight loss plateau or even a slight gain. One of the great things about the diet is that all spices without sugar are allowed. So salt, pepper, garlic, mustard powder, basil, thyme, chili pepper are all allowed. In the recipe section of the guidebook, we have several different rubs that are all HCG friendly. And you can give your meat and fish a nice flavor, from Greek to Italian to Southwest. You can use stevia as a natural sweetener, but you cannot use sugar or any other sweetener. No oil, butter, or dressings are allowed. You can have apple cider vinegar, but no other vinegar like balsamic vinegar. You can drink tea and coffee as well, but remember you can only use stevia as a sweetener. You are allowed 1 tablespoon of milk per day, so planning may be necessary. Remember, you can also make iced coffee or iced tea. If you are a vegetarian, you will have half the weight loss of a non-vegetarian. Check the guidebook for allowable substitutions. Everyone is different, but some of the sensations include a slight headache, in which you can take an aspirin or other painkiller. Often the headache intensity is connected to you coming off sugary drinks like sodas. If you don't load properly, you will have some hunger and discomfort. You can expect a high initial weight loss. Some people lose a half a pound to 2 pounds a day, but then it will slow down. Men generally lose more than women, just because they have more muscle mass and burn more fat for energy. Plateaus will happen to everyone, and when it does, it's pretty disappointing. Typically, your weight loss will slow down or stop at the end of the 2nd week, beginning of the 3rd week, but it can happen any time. One of the things about the diet is it's very unforgiving. If you have a sip of wine one night or a bite of a donut at the office, you will most likely stop losing weight for 2 to 3 days. It may not occur the next day, but a day or two afterwards. It's very important to maintain your food journal so you can see if there were any food or drinks that were not on the approved list. And remember, be honest. If you went off the program, don't expect to have a half a pound to a pound day loss. You may end up with a 1/4 pound day average loss. Plateaus always happen when you either intentionally or unintentionally cheat. And they will happen to everyone at least once during the diet phase, even if you didn't cheat. So be prepared to have a couple of days of no weight loss during the program. When you have lost the weight you wanted, or have completed a maximum of 40 days of injections, you will need to stop taking the HCG but continue the 500 calorie a day diet for 72 hours until the HCG has left your system. Remember, at the beginning of the program you needed to load for 2 days until the HCG took effect. Well, now you need to wait 3 days for the HCG to leave your system. Now, once you've completed, you're going to increase your calories to a minimum of 1,200 for women and 1,500 per day for men. Now you begin the maintenance program, which will be 3 weeks of you eating anything you want but no sugar or starch, followed by 3 weeks of slowly adding sugar and starch. The body needs this time to reset its metabolism and a normal weight. If you cheated in the first 3 weeks, you will not reset your weight or reset your metabolism. There are 2 phases for maintenance. In the first phase, you'll be able to eat whatever you like, but for the first 3 weeks, you cannot eat any sugars or starches. For phase 2, you'll spend another 3 weeks, but this time you'll be slowly introducing sugars and starches into your diet. But only add 1 per day. For example, on the first day you may add a half a cup of rice and see if you have any weight gain the next day. If not, try half a baked potato the next day and see if you are sensitive to that carb. The goal here is for you to understand which starches cause you to gain weight, so you can reduce your consumption of those foods in the future. We have created a guidebook to help you through the program. In the guidebook, you will find a list of tips, initial shopping lists, sample menus for the first week, calorie counts for all the approved food. We have information on the maintenance phase, and we also discuss apple days and steak days and when you should do them. Included is also exercise options, a weight loss log, daily food journal, and over 50 HCG-friendly recipes. The program guide also covers the glycemic index of various fruits and vegetables, how to read a nutrition label, serving sizes, and tips on eating out, dealing with cravings, and emotional triggers. The most important part of the Clean Start HCG weight loss program is the comprehensive support you will receive. Not only will you receive the Clean Start patient package that includes program guide, cookbook with over 50 recipes, food journal, tip sheets, and a mobile-friendly shopping list to use with your smartphone. In addition, you will receive weekly support from your certified Clean Start Weight Loss Clinic. You'll have an opportunity to get your questions answered either in person, on the phone, or through email. Remember, the Clean Start HCG program is not a long-term program. All you need to do is follow the program for 23 to 43 days. That's it. You will not be deprived of the foods you once ate. You will be able to eat them soon enough. It's very helpful to keep that perspective. You only have 14 days left, 7 days left, 3 days left. Over 60,000 people have lost weight on this program since 2011. And the great thing about the program is you only eat healthy food that you can find in any grocery store. And best of all, you will receive the Clean Start Patient Support Package that will contain the details of the program, tips, recipes, and everything you need for long-term weight loss success. After the program, you are free to eat whatever you like, but remember the decisions that gave you that weight gain in the first place. Make the right choices now and you'll have a clean start. As well, long-term weight loss is most likely maintained when you combine healthy food choices with daily exercise. To help you stay motivated and keep the weight off, we also offer a monthly healthy lifestyle program. With this program, you will receive a monthly B-complex vitamin injection. You'll have an opportunity to ask any questions you like to our staff. We can record your measurements and take your blood pressure. You will also receive a monthly support email with great healthy eating and exercise tips, along with a printed copy of the Clean Start Weight Loss book that contains exercise routines and more healthy recipes. For information, please contact your nearest Clean Start certified practice or visit www.cleanstartweightloss.com.